if that's the way you're going to go. But certainly, yes, after a week you can get back in the gym. I don't see any problems with all that. I wouldn't suggest getting back into the swimming pool, because sometimes you can't get into swimming pools. They've got bacteria in them, and it goes into your nose, it goes into your mouth. So perhaps I'd stay away from swimming pools. But at the moment, you know, we're not allowed to do anything anyway. We're locked in at home, so we can't do anything. So a question, what are the health benefits, the item numbers? Well, look, I think if you've got all these questions, when you call the surgery, you're going to ask for my coordinator, Rochelle. She's the absolute expert on all these things. She's got a lovely English accent, so you might have to ask her a couple of times what she said. But she will tell you, give you all the item numbers. She will talk you through the whole procedure. She is your concierge. So when you arrive, from the day you arrive to the day you finish, she is going to be your concierge, and she is going to look after you, and she is going to make sure you get through this journey very happily. And it was a positive and a good experience for you, because good experiences is what we have, and people just keep coming because of that. I smoke. How long should I give up before I go on this journey? Well, you know, some people, I always say, if you stop smoking for a day or two before, 2-3 days, that's really good if you're having a general anaesthetic. So you don't actually have to stop the smoking for a month or 2 months or 3 months before. What we asked is that you stop smoking once we've done the procedure. So don't smoke before we're going to put you to sleep. We don't want smoke going over stitches, raw tissues. We want to give them a chance to heal. So you can 2 or 3 days go cold turkey. Some people go for patches. Some people, you can go to your doctor. There's all sorts of things. I've even had people go through hypnotherapy. So there's a lot of things you can do. But you basically need to stop your smoking just a couple of days before the procedure, and then after the procedure, then we hope you stop. So the anaesthetist, is that an extra expense, I'm asked? Yes, it is. The anaesthetist is an independent person. Obviously, he's in charge of your health, your life. He has a fee, and Rochelle can discuss all those things with you. Is it still considered all on 4 if you need more or less than 4 implants? Well, that's an interesting thing, because all on 4 is 4 implants. Sometimes we put in 5 implants if you're a heavy grinder, and sometimes we might put in 6 implants. But sometimes there's not enough room to put in those, because if you look at the anatomy of the jaw, and you think, I'd like to put in 6, but there's where you'd put in 6, you need to put them at the back of the jaw, and then you run into problems. I don't know, I've got a whiteboard here, if you can actually see, if I draw something very large, and you see, here's your nose, here's your sinuses here, these are your air spaces, this is your sinus here, and the distance here sometimes is really short, and you haven't got enough room to put the implant in. And the all-on-4 implant runs on the angle like this to avoid the sinus, because this is air. So when you put 1 implant here and 1 implant here, 1 here and 1 here, if you try to get another one here or another one here, it's too crowded. So you don't want too many implants in there. If you have 6, normally what you do is you put an implant back here, but that's in air. You can't do that. So therefore you'll need to have bone grafting and do the other procedure that's not all on 4. Now, if you're keeping some of your teeth and you're just having implants in between them, then that's certainly just having normal implants, and I wouldn't really consider that as all on 4. So I hope that explains that reason, because often people get confused here. All on 4 is done. The back implants are angled for 2 reasons. One, to avoid the airspace, and secondly, there's a thing called a cantilever. So if the teeth sit here on the teeth, you don't want this bit, the cantilever, to be too long, because if you have something that looks this long and you put weight on it, it'll bend. But if you put something that's this length and you push on it, it won't bend. So that's why instead of the implant being straight, it's angled so that you have less cantilever. These are all the things that Professor Malo carried out and invented. That's why it's such a wonderful procedure. And that's why you stick to the way the procedure's done. Otherwise, what's happened is you're not getting the gold standard. Oh my goodness, I can see there's 31 more questions as they're coming through. Do I still brush my teeth once I have implants, or just machine you just showed? You do three things. You brush, you use the machine, and you use dental floss. And we will show you that and exactly how to do it. And we'll make sure that you're doing it, and we'll bring you in to check. And if it takes extra appointments to bring you in, they will be free to bring you in to make sure you're looking after it, okay? So really, I think the important thing is, I actually had a dentist has actually sent a message in, and let me go back, and he asked, it's a really relevant question. And it said, let me see, I've missed the thing where I go. As a dentist, research for me is important, the type of implants used. Thanks for clarifying. So really, it's important, as you'll know, that people are bringing out other systems because this is such a good system and this is such good treatment protocol. So they're getting onto the market, but please, until they've got research, don't go near them, because they all fall short in a lot of ways. And I can tell you that because I have been doing this for many, many years, and a lot of the other implant companies have come to me with their designs. They come to Professor Malo all the time, and they fall short. And they fall short of the things I've told: the design of the implant, the size of the implant, the tip of the implant, the threads on the implant. So don't compromise the treatment. It's just not worth it. Okay, hi Larry. Do the implants in the second set of teeth have a lifespan? Great question. Yes, they do. The teeth are made of acrylic. So the first set of teeth we put in for 3 months. We put them in for 3 months because we're waiting for the bone to actually grow onto the titanium rods. So then what happens is we want to then quickly get into the bar, because we don't want the teeth to break. Because I've seen people, and that's the biggest problem, when people come to me from Thailand and from overseas, they ended up with the first set of teeth. They couldn't get back to get the bar done, either because of COVID, or they didn't know and they weren't told, or they didn't realise the extra expense, and the teeth break. And if the teeth break, they could damage an implant. We hope not. It doesn't happen very often, but it could potentially. Acrylic is a material that will wear out. So we say that the bar has a 5-year warranty on that bar, and I bet Noble Biocare is a wonderful company. If it broke in the 6th year or the 7th year, they'd replace it anyway, because they're such a good organisation. The teeth, I say the acrylic, have a 5-year warranty on them. So at the end of 5 years, you're actually going to have to replace those teeth. And at today's rate, that would be about $2,500 to replace the acrylic. You don't replace the bar, just to replace the acrylic. Oh, here's a great question. What's the real recovery time, and what's the real pain do you go through? I won't mention who asked that, but it's a Gary. And really, Gary, I can tell you, if you come into the clinic, you'll see a lot of people that have it done, and you'll meet people that have it done, and you'll see, and the pain is, as I've said, and the pain is much, much smaller than you think it's going to be, and the recovery time is a week. And that's having done thousands of cases. So one thing that we do is we tell you warts and all what it is up front, and I'm telling you how from experience that works. Okay, so please, and if you come in, be lovely to see you, and we can actually see some patients that have had it done. So I think that's very important. Now I'll come here. What is, please let me know if you have payment plans. Brenton, yes, we do, but you'll need to speak to Rochelle. So and Rochelle will be able to explain all the different options for payment in great detail. Someone said, haha, free Botox. No, doesn't. It costs to have the Botox, so I'm sorry about that. Payment plans, look, I don't get too much involved in the payment plans in terms, I'm here for your care. We certainly tell you everything about money, but I leave my staff to tell you about the payment plans. And I actually don't know every one of them, to be honest, but they do, and they're the experts on that, and they'll be able to help you. So I hope that's sort of given you a great overview. And you know, I just see there's another dentist come in, and he's commented about another implant company that's come onto the market with an implant, and he's trying to be controversial, but the implant only comes in 10 millimeters to 15 millimeters in length, so it's not relevant for all on four. Anyway, look, I really want to thank you so much for having spent the time. It's really pretty good modality now to be able to actually have enjoyed, you know, and I enjoyed giving it to you, explaining what it is. So I want to thank you. There was a lot of questions, taking the time to listen. Please, if you feel that you want to come in and see us, you just need to call the clinic at Bond Street and speak to the staff. They're going to be very welcoming to you. You'll meet Rochelle, my coordinator, and we can help you along this journey. So if we've actually missed anything, we will certainly cover everything when I see you. And I hope you have a very good evening, and it's been a real pleasure speaking to you. Good night, and thank you.